everyone, welcome back to my YouTube channel. Today we are going to talk about Norma Frontalis. We'll start our topic with introduction. Norma Frontalis refers to the anterior view of skull, showing the facial bone and frontal aspect of cranium. This view is essential in anatomical studies, medical imaging, and forensic identification, providing a comprehensive understanding of facial symmetry and skeletal structures. Norma frontalis is frontal perspective of skull, allowing examination of facial proportion and bony alignment. It is crucial in dental, surgical, and forensic applications for analyzing structural variation, fractures, and deformities. Now let's talk about bone visible in Norma frontalis. Several bones contribute to the front view of the skull, forming the facial framework and cranium. These include frontal bone, zygomatic bone that are also called as cheekbones, nasal bone, maxilla, and mandible. The first bone we are going to talk about is frontal bone. It forms the forehead and upper part of orbits or eye sockets. Its features include supraorbital foramen that allows passage for nerves and blood vessels. Next bone visible in Norma frontalis is zygomatic bone that is located on both sides and defines facial contours. It articulates with the temporal bone, frontal bone, and maxillary bone. Next bone in the Norma frontalis we can see is nasal bone. It forms the bridge of the nose connecting the maxilla, and it provides attachment sites for nasal cartilage. Next bone we have is maxilla that houses the upper teeth and forms part of the orbit and hard palate. It contains the infraorbital foramen that allows passage for nerves and blood vessels. The next bone we have is mandible that is also called as lower jaw. It is only movable skull bone. Its features include mental foramen that is visible from the anterior view or Norma frontalis, and it allows the passage of mental nerve and vessels. The next structure we can see from the Norma frontalis is orbital cavities that houses the eye, and they are formed by frontal bone, maxillary bone, zygomatic bone, sphenoid bone, ethmoid bone, lacrimal bone, and palatine bone. They are basically seven bones that form the orbits or walls of the orbits. They protect the ocular structure and provide attachment for muscles. Now let's talk about the key features of Norma frontalis. The first key feature is glabella, that is smooth area between the eyebrows. The second key feature is nasion, that is point where the frontal and nasal bone meets. The third key feature is mental protuberance, that is basically the chin prominence or protuberance. The next feature of the Norma frontalis is interorbital distance, that is basically the distance between both orbits, and it is important in forensic analysis. Now let's talk about the clinical and surgical application of Norma frontalis. It is used in facial reconstruction and orthognathic surgery. It is essential in forensic anthropology to determine individual identity. It helps in analyzing congenital anomalies and traumatic injuries. Now, conclusion or endpoint. Norma frontalis provide vital anatomical details, facilitating study in medicine, surgery, and forensic sciences. Understanding the skull view helps in diagnosing condition, planning treatment, and identifying facial proportion. And that's the reason Norma frontalis study is important. So this was about the Norma frontalis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment, and do appreciate our efforts. Thank you for watching.